for your weekly dose of freedom. Ladies and gentlemen, the man of peace himself, Marc J. Victor brings the Attorney for Freedom show.
What a great intro, huh? I love that introduction. Is that the best intro you've ever heard to a radio show?
Especially for an attorney.
And actually, this is show number 3, Joe.
It is.
And you're going to be shocked to know I actually have an introduction for my guest today.
All right.
Which is the first time I've ever introduced a guest.
That's right.
All right, so here it goes. So today's guest is Dr. Jeff Singer, who happens to be a very good friend of mine for many years. He's a surgeon with a practice in Phoenix, Arizona. He's also a longtime friend and a longtime libertarian. He's the founder of... All right, look at that. Our crowd is happy with that. Longtime libertarian. That's our in-studio audience.
That's right.
Yeah, they're hiding back there somewhere.
They hide back behind the pool table.
We don't like to show them on the camera.
Right.
Okay, so he received his... actually, he's the founder of Valley Surgical Clinics here in Phoenix. Received his MD from New York Medical City. But don't be... he's still a good guy, even though he spent time in New York, right? You're not a Jets fan or anything like that, are you?
No, actually, I was more of a Giants fan.
Oh, that didn't get any better there. Okay, so he was elected to Alpha Omega Alpha, which is the Honor Medical Society, completed his at Maricopa County General Hospital, Phoenix, Arizona. He's board certified in the specialty of general surgery. He's got over 20 years experience in his field. He does general and laparoscopic surgery. He's a fellow of the American College of Surgeons, the International College of Surgeons, the Southwestern Surgical Congress, and the American Society of Abdominal Surgeons. His areas of practice include both general and laparoscopic surgical services. And just as a shameless plug, he can always be reached. So if you're mad at him and you want to contact him, or you want to just tell him he did a great job today, you can reach him through his website, which is valleysurgicalclinics.com. We're here today to talk about national health care, otherwise known as Obamacare. And Jeff, by the way, was also very involved here in Arizona back in the 90s in what we lovingly call as Prop 200, but it's actually, it was our first attempt to try to get rid of some of the craziness with the marijuana laws, where what we said was simple possession, which in Arizona is just a simple marijuana cigarette. You can't go to prison for 2 years. That was the big radical change that we had in Arizona. You have to get probation for your first. That was the first step, one of many. And now we've actually got medical marijuana. If people like me get our way, eventually we'll have complete legalization. We'll be on our way to freedom. So, Jeff, welcome to the show.
Thank you, Mark.
Great so we're going to talk about... Everybody's talking about this Obamacare, and I don't think most people really understand exactly what it is.
I can tell you that I don't. I mean, I've heard some little bits and pieces from a different show, from my Doc Talk show, that I'm surprised that you've never been on that show either. That's the Chief of Staff, Dr. Ann Borick, does that show with me.
Well, what's amazing is, in my experience, the people who are most excited and supposedly pleased about Obamacare are the young people, the people like in college and just getting out of college, and they're the ones who are all excited and say, "Isn't this great?" And mainly it's because they're able to stay on their mom and dad's health insurance until they're 26 years old, and they don't know that they're the ones who are going to get the most hosed by this. These are the young generation, people under 30, are the biggest victims.
Wow.
Because they're basically going to be forced.
So, Jeff, can you take a couple of minutes? I know it would take hours to thoroughly explain exactly what the heck Obamacare is, but in sort of a general way, can you give us sort of an overview and say, what the heck is this Obamacare thing? What does it mean?
Yeah, well, I was just getting to what basically the whole pretext behind it, first of all, was this notion, people who heard the debates, they kept hearing it said, anytime a person shows up in the emergency room without health insurance, they get care, and then we all end up paying for it. So we got to do something about that. So why don't we come up with a system that forces them to buy health insurance, because that way they won't be free riding off of everybody else. And without thinking in a lot of depth, a normal average person might react. That notion is, what's up with these people free riding all the time? Fact is, there's a lot of fallacy. It's a big myth about that. Studies have been done from anywhere from the Liberal Urban Institute, a respected think tank in Washington, to the Congressional Budget Office, a nonpartisan organization in Washington. And both of these and others have shown that the percentage of healthcare dollars in the United States per year that goes to what's called uncompensated care, in other words, people who end up getting the health care without paying for it, is about 1.2% of all healthcare dollars. And it's been estimated that the cost shifting to the people with insurance by those who don't pay for their healthcare bill probably raises health insurance premiums by about 2%. So this thing is totally overblown, because what a lot of people don't do as a practicing physician, there are people, of course, who don't have insurance and wind up getting care and don't pay their bills, but there are also plenty of people who don't have insurance and do pay their bills. A lot of them make the conscious decision that they don't want insurance, they don't think it's a good investment for them, and then when they go to the doctor, myself included, they say, how much do I owe you? And they actually pay. And a lot of times they end up paying a higher price than the insurance companies pay, because they didn't use their leverage to negotiate a discount. So they're paying so-called retail.
I have to say the problem of people going in and getting health care without health care insurance and not paying is somewhat overblown.
Way overblown. And in fact, people who understand economics and marketplaces realize there's always going to be free riders, you know, and those costs always get shifted onto everybody else. For example, when you go to the supermarket and you buy groceries, there's always some people who break something in aisle 5 and or who slip out shoplifting something, and that happens every single day, and the store owner works that into his, that's part of
they
the
pass
store owner's
that cost
cost.
along.
So you can't escape it. It's just a reality we have to live with, and the fact is, though, it's a very small part, but that was used to basically be the push to create Obamacare. So what Obamacare ended up doing was, it says that everybody has insurance or get a fine, okay? Now, once the government gets into the business of saying you have to get health insurance, then it begs the question, okay, so what satisfies the requirement so they don't get a fine? How about if I get health insurance that costs me $50 a month, that's a $10,000 deductible? Is that good? I got health insurance, no fine. Well, you know, of course, when you do that, the government next has to say what satisfies their requirement. And then it gets opened up to the whole political thing. So every single special interest group saying, well, you know, this health insurance that you got to force on people, it's got to cover this, it's got to cover that, it's got to cover my thing, it's got to cover, because, and of course everybody's wanting to make sure they get some money out of the deal. So by the time they were done, basically the U.S. Congress, basically the leadership of the Democratic leadership of the U.S. Congress, Nancy Pelosi, Harry Reid, etc., they designed what insurance you're going to have to buy. You're going to have basically 3 choices: a bronze, a silver, and a gold. And there are going to be 3 deductible levels. So even though you may decide that, you know, I can afford a $5,000 deductible, that's cheaper by lowering my deductible, and I really don't need coverage for, let's say you don't believe in you're a Mormon and you don't drink any alcohol or use any chemicals, so you don't need the insurance that covers chemical dependency rehab, and you're a single guy, so you really don't need infertility treatment, and you really don't need coverage for female birth control pills because you're a single guy.
I probably don't need pregnancy coverage.
Probably
right?
don't need, but it's too bad, because you're going to have to, the insurance you buy has got to cover all those things that I just mentioned, and you can't have more than $2,500 deductible. You're going to have a choice between a $1,000, $1,500, and $2,500. There's going to be 3 plans. The insurance companies are reduced to nothing more than basically handlers, because back in the old days, some of the listeners are maybe old enough to remember before the airlines were deregulated in the late 1900s. Basically, the fares were the same. The routes were determined by the government, and the only difference between American Airlines and Pan American and TWA was some had nicer looking flight attendants than others, and some had better meals.
Yeah, you know,
and that's what it's going to be like. Whether Aetna, Cigna, it doesn't matter. There's plan A, plan B, and plan C.
It's like back where I'm from in Massachusetts, and I know there's some people listening from Massachusetts. I don't know if it's the same way today, but when I was living there, auto insurance was the same. It didn't matter what company you went to; the rate was exactly the same. So I mean, even as a kid, when I was getting auto insurance and thinking about what company, it was kind of like, what difference does it make? They're all the same rate. And I remember that Allstate was one of those companies that just said, you know what, we're not doing business in Massachusetts anymore because we can't afford it at this particular rate.
It's interesting that you mention that, because here's what else happens. Again, when a person who doesn't understand politics works just hears this on first blush, it sounds fair. So the politician said you shouldn't be turned down by an insurance company because you have a pre-existing condition, and you shouldn't be penalized for having a pre-existing condition. You shouldn't be charged more. Well, if you think about what insurance companies do, basically insurance companies' contribution to the economy, to the ecosystem, if you will, is that they assess risk. That's their, in the grand scheme of things, that's what they do. So if you wanted to build a house in the middle of a floodplain and you want to buy homeowners insurance, the insurance company is going to either tell you after they check the thing out for you, they're going to do you a favor. They're going to tell you, you're planning to build this in such a bad place that I'm not even going to sell you insurance. They're doing you a favor. They just gave you a warning. Or maybe they say, I'll sell you insurance, but it's going to cost you an arm and a leg unless you move it to somewhere else where I might sell it to you for less. So that's the risk. They're doing risk assessment for you. And you're buying insurance to insure against an unforeseen, non-preventable risk. So if you're going to tell a health insurance company that you got to charge the same amount to a 30-year-old non-smoking triathlete as you charge to a 30-year-old IV drug abuser who has AIDS and hepatitis C and continues to use the drugs, and you can't charge either one any differently. And you can't turn either one down, because that's the other thing in this new plan. So the insurance companies are basically no longer insurance companies because they can't assess risk, they can't charge anybody different, they can't turn anybody down. So the insurance companies now, they have, since the way they pay for claims is they calculate how much money they need in this, put money into, so they have enough money in there at any given time to dish out claims and have enough money left over to pay themselves for the trouble of doing this, or it's not worth their while, okay? So if you're telling them that they can't turn anybody down, they can't charge differentially based upon risk, and they got to cover all this stuff whether people want it or not, a whole lot of things that are expensive, they're going to have to calculate a huge, so for example, where they may have been charged for a $2,000 premium to a 30-year-old non-smoking triathlete, they may charge them $70 a month, and the HIV positive heroin user, they would have charged him $1,200 a month, because they're basically estimating how much he's going to be taking out of the pool. They got to charge him the same, so they're going to charge him both $900 because they run the math and that's what they figure. So now this 30-year-old non-smoking triathlete's paying $900 a month for health insurance.
And now there becomes an economic disincentive to try to stay healthy.
Well, not only that, if he's smart, he's not going to buy it, because remember what they say: you can't turn a person down, and you can't change. You can't charge any differently for pre-existing conditions. So you're 30 years old,
right?
Yeah, why not wait until you get sick?
Wait till you're on your way to the hospital.
Sell it to you. They can't turn you, and you're not going to be charged any differently. If auto insurance was handled that way, you'd be out of your mind to buy auto insurance. Wait till you get a car accident, whip out your cell phone, call State Farm, say, "Listen, I'm in an accident right now. I want to buy insurance."
So it sounds to me like what we have is a disrespect for the notion that free markets are pretty good at pricing goods and services. In this case, the service is healthcare. Right. But it would be this really is that at its fundamental level, the difference between capitalism and socialism. I mean, in the socialist world, the government comes in and says, "Here's a widget. The price of this widget is X." You know, X is going to, by necessity, be too high or too low. And whether it's too high or too low, there are problems in the market. The free market may adjust the price from time to time, but at least it's based on market factors. And if they set the price too high, that people don't want to buy. If they set the price too low, they can't make a profit.
Or the other thing that the insurance companies do by setting the price high, they make you think about your behavior. Maybe I ought to, not, like I say, not live in a floodplain. Or maybe I ought to give up. Yeah. So what it's basically doing is it's rendering to the consumer, it's taking the cost out of the equation. So there's no incentive for the consumer to cut back on consumption, and that makes things cost even more. But here's the thing: the insurance companies, when this whole thing was being debated, said, "Well, we like the idea. I mean, we have no problem with complying with all these things, you're basically lowering our deductibles, making us cover more stuff, and not turning anybody down for pre-existing, etc. Because we're going to charge people for that, so we're not going to lose any money. We'll charge them $1,500 a month, whatever. But nobody's going to want to buy it except the people who need it. So you're going to have to make them buy it." That's when the part of the law came in saying, we're going to force you to buy it or you're going to pay a fine. Unfortunately, because of politics, the fine is next to nothing. It's the first year the fine is $95. Over about 6 to 8 years, it works its way up to a maximum of 2% of your income.
Wow.
Okay, so again, you're a 30-year-old guy, you just $45,000 a year job.
Yeah, why sweat it?
Yeah,
Take
pay the $95. Come on.
For health insurance,
Yeah,
everything's
so
covered.
what's going to happen is less people will buy rather than people who are buying now, especially since the 30-year-old guy might have said, I'd buy health insurance if I can get a $5,000 deductible that just covers like big things because I'm a healthy guy. I'm not going to need anything except the big stuff. But that's not allowed. That's not available. It's one of those 3 plans. So I said, screw it. I'll just wait till I get sick. Okay, so what's going to happen is more and more of the healthy people are going to drop out of the pool. Who's left? The people who need it, which means the insurance companies who run the math are going to say, actually, we thought you're going to have to put in $1,200 a month. We got to raise it to $1,500 a month because we don't have enough money going into the pool because all the people who are healthy and not taken out of the pool are not kicking into the pool because they're deciding to pay the fine.
But this
so
is
it's going to cause a spiral of higher and higher prices until people complain to the government, and then the government is going to step in altogether and say, all right, this quote-unquote free market way, this isn't working. We're going to just have the government take over everything, and then we're all going to be in a government-run system. We'll all be good, kind of like.
I got to jump in once in a while here because what I do is field about 4 or 5 calls, and I turn the phones off, throw them in, and then keep answering them. So if you guys don't mind, let me just throw them your way here and respond however. Fred White, Miramar, Florida, says, why is every doc that I've ever been hating Obamacare? I'm not even employed, and I love it.
Well,
that's kind of a no-brainer there, huh?
Well, the main reason we docs hate it is because since the costs are guaranteed to explode because of the reasons that I just explained, there's no incentive for people to not use, and everything is more costly. People, how the costs going to come under control? Well, the first thing that's already happening has been going on for about 4 or 5 years, and actually driven by Medicare before even Obamacare.
You're going to say rationing, right?
Well, that's coming. But right now we're being forced to practice according to algorithms, protocols, and guidelines, cookbooks that are drawn up in Washington. So we're being told this is how you will take care of this problem. This is how you take care of that problem. If you don't follow this, you must have 4 reasons for not following it, A, B, C, D. If not, you got a problem, and you're going to be sanctioned. So we doctors, by the way, that's an old bio of mine. I've been practicing over 30 years. And we doctors are being told all of a sudden that after 30 years of experience, this is the way you have to practice. I don't care what you think is right or wrong. This is the way you have to practice. That's number 1. Number 2, in order to up, the payment to the doctors in the hospitals are going down. And more doctors are starting to say, you know what, I'm out. I'm not taking any, some are saying, depending on their specialty, I don't take any insurance at all. I don't take Medicare. I don't take Medicaid. I don't take insurance. I'm going to become a private cash-only doctor.
Well, you and I have a mutual doctor who had a big practice, who, when some of this HIPAA stuff passed, and he realized that he was going to be subject to possible criminal penalties for simply filling out the billing paperwork, he decided to shut down his practice, and now he does breasts and facelifts for 100 cents on the dollar. It has nothing to do with insurance. But as society goes, we lost a good doc doing really important things.
A lot of primary care doctors are going into so-called concierge medicine, where they're basically cash only. All the doctors are exempt from these rules if they don't participate in any of the insurances in Medicare. So you're going to start to see gradually more and more doctors setting up these private cash-only multi-purpose clinics for all the specialties, for surgeries. And then a lot of them who are maybe in their 50s are going to say, I didn't sign up for this. I signed up to be a doctor, not to have somebody give me these rules of how to practice, oftentimes against the way I think is the right way to practice, and to work all these long hours for no compensation. Forget it, I'm out. And they're quitting and retiring earlier. And there's a shortage developing already.
Wow.
And there's an interesting thing for people to understand. You could have a card that says you have health insurance coverage. That doesn't mean you have health care. Ask the Canadians who wait 2 years for heart bypass surgery. They got health coverage, but so many of them die like in month 9 waiting for their heart
Well, you know,
bypass.
I learned about an interesting situation the other day. I've got a friend who needed some kind of a surgical procedure that it was not covered by his insurance, and it cost him about $25,000 here. So he learned that some of the American doctors here have set up surgical clinics outside the country in Mexico, just across the border. And he said, I'm going to Mexico for a surgery. I said, are you nuts? He said, no. I'm going across the border. I'm going to a surgical center with American doctors, American nurses, to American standards, but I'm going to pay $4,400 for the procedure. Then I'm driving back for the aftercare here in the United States. I said, boy, if I was a doc, that's the first thing I'd be doing right now.
Well, more and more doctors are actually starting to do that.
Wow, that was dental. Now it's doctors too.
Yeah, you're starting to see these kind of things happening. But about rationing. Part of Obamacare, in order to keep costs under control, it sets up a thing called the Independent Payment Advisory Board, or IPAB. Now, I got to give a little background. Back when the so-called stimulus package was passed in 2009, part of that package set up a thing called the Federal Commission for Comparative Effectiveness Research, FCCCR, or you fucker. And we can say that on the
I think we can.
Okay. So anyway, and it also, in that stimulus package, they forced all doctors and hospitals to become electronic by 2014. Now, going electronic doesn't cut down on errors. In fact, sometimes it increases errors. But what it does do is it gets the government access to data. So by 2014, the plan is that virtually every transaction, if you go to Walgreens and you buy some cold medicine, because they're also involved, any pharmacies, etc., all that data is being collected by this FCCCR in Washington, okay? And then the IPAB will use this data, they do comparative effectiveness research. So they're basically looking at this, on a big macro level, epidemiological level. They're going to say treatment A works better than treatment B, so we're going to allow treatment A but not treatment B. Now, as a doctor, I can tell you maybe treatment A works well for this guy, but treatment B works better for that guy. But they're going to say this is what's allowed and this is what's not allowed. And the way they're going to do it is through the Independent Payment Advisory. They're not going to say they're rationing care, because that would be politically.
They're going to say you don't need this particular.
No, what they're going to say is, doctor, we're not going to tell you what to do. But if you do treatment A, we're going to pay you $1,000. If you do treatment B, we're going to pay you $25.
Fantastic.
You make the call. You're the doctor. And that's how they're going to do it. It's the Independent Payment Advisory Board.
We're going to go to a call, but I just want to make one comment here. I'm just curious about something. So many people thought that getting free health care in the United States was such a great idea. What percentage of those people do you think really understood what this thing is about?
Very small percentage. Like I say, all these young kids from college who are all excited, they think this was the greatest thing since sliced bread, because all they know is that they get to stay on mom and dad's health insurance, which raised the premium as well, until they're 26. But wait until they get out and they get their, after they get their master's degree and they take their position at Starbucks, and they find that, or they think, I'm seriously, when they get out of college and they're looking for a job, and they get an entry-level job for a college graduate, and they're making maybe 35, 40 or something like that, and then they find that they're going to be forced to pay $800 or $900 a month for health insurance that's way more than they need. And the reason they're being forced to do that is to keep my premiums lower, because I'm needing it because I'm getting older. And so since they're being forced to put money in the pool to pay for me, again, another transfer of money from the young to the old.
This thing's going to be a mess.
All right, we got Lydia Swanson from Norman, Oklahoma, that says, let's all stand up and rebel and get rid of this stealing from the Americans.
It is
Obamacare.
It is stealing from the Americans, but this isn't just something that's unique to the healthcare industry. I mean, the government is out stealing from everybody, everything, every company, in every industry. That's what governments do. They take resources from one by force, and then they redeposit those resources to people and companies that they see fit.
Yeah, but Mark, what makes it really poignant is the fact when you get into, I agree with you completely, but when you get into healthcare, now you really control people, because in the name of controlling healthcare costs, this opens the door to the government regulating almost every aspect of your personal life. they're going to, in order to keep costs down, they're going to. It's already happening. You know, look at the mayor of New York. They're
I
going
was
to tell
just
you
thinking the
how
sugary
much
drinks.
salt you can have in your food, how much sugar. They're going to require you to show that you go to a gym twice a week.
It's kind of like being the parent and saying to the kid, look, I'm paying the freight around here. If you want to live under my roof,
Right.
you got to follow my rules, and there's a certain logic to that.
Right, and politically, they'll use the same argument they use to sell Obamacare. They'll say, every time this guy misses his gym appointment, we end up paying for it.
Well,
You
you know
got to
what?
force him to
You know
go
what
to the
Pete,
gym.
Pete K from Columbia University called in and said, I challenge people to watch Mark Victor's show, Attorney for Freedom, for 1 month because they will become libertarians.
I hope so.
He said, Mark, you're the best.
Oh,
That
thank
was
you
Pete
very
K,
much.
Columbia
Thank you very much for
University.
that. You know, and I think it's important to point out, too, that it's not like we had a real free market in healthcare before Obamacare. I mean, we were a complete disaster, train wreck in healthcare, even before Obamacare. And one of the things that I think is sort of an interesting thing to discuss, and you tell me if I got it wrong, Jeff, but somebody shows up at the emergency room in needing care and says, look, I don't have any insurance and I have no way for this. Can the emergency room turn them down and send them away?
No, you know, it's interesting you bring that up because, again, the government creates a problem, and then they use the problem that they created as the justification for this next thing. So that what you're talking about is a law that was passed in 1986 called EMTALA. Stands for Emergency Medical Treatment and Labor Act. And prior to 1986, most cities and counties had and private organizations had indigent care facilities or charity wards. Yeah, charity wards. I trained at a county hospital which took care of indigent people. Taxpayers funded the hospital to take care of indigents. Now, it's not fancy. You may be in a ward with 6 other patients, and your primary doctors are residents who are supervised by, by professors. But you get the care, okay, and the price is right. And what would happen, and this was even in my day when I was on my training, a person would show up in an emergency room that doesn't have insurance, and was stable for transfer. That doctor who saw that patient in the emergency room would call the indigent care facility, whether it's a county hospital, the city hospital, St. Mary's or whatever, and say, I have this person who needs this care but doesn't have insurance. Could I transfer them over to you? Because you have a system set up for that. And they would accept the transfer. And of course, from a liability standpoint, and you could appreciate this as an attorney, both parties then have a responsibility of making sure that the person is stable for transfer. Okay? And that was the standard. Well, then in about 1985-86, there were a couple of really high-profile situations, primarily in Chicago, where women who were indigent, who were in labor, were being transferred into Cook County Hospital for financial reasons, and they shouldn't have been transferred. They were not stable for transfer, and the accepting physician should have said, I refuse to take the patient unless, because you haven't convinced me he's stable. And there were some bad outcomes. I think there were a couple of deaths, or the babies were born dead or something like that. And of course, this made a lot of news. And I remember I was in practice at the time, and I was thinking to myself when I read it in the news, boy, those are going to be big malpractice settlement awards, because there's already a system in place to take care of that. There's going to be some suits. The hospitals and doctors are going to get together and say, okay, we got to tighten up because we can't let this happen again, et cetera, and it's going to fix itself. But like anything, just like what happened in Newton, Connecticut the other day, all of a sudden the politicians had to get into the act and fix it. So they passed EMTALA, which says that you cannot transfer a patient from one institution to another for financial reasons, period, unless that person requests it. And so starting in 1986, the new regime was you couldn't actually fully utilize indigent care facilities that were set up for these people. Here in Arizona, we have the Maricopa County Medical Center, which was set up to take care of indigents. It's still getting taxpayer funding, and it's half empty because you can't transfer people to it. So they create this problem, and in addition, word gets around, hey, if you go to the hospital, you don't have insurance, they have to take care of you, so go.
Yeah.
They create that problem, and then the politicians used that issue, that every time a person goes to the emergency room without insurance, they have to get cared for, and we all end up eating the bill. They use that to justify Obamacare.
You know, the two words that come to mind in just what you laid out are unintended consequences, right? We always have unintended consequences. That's of the rub here. This Obamacare, what strikes me is you're talking about it. These are things that you know about. These are things we can see right now that are going to happen, that are going to be horrendous consequences. We can't even yet talk about all the things that are going to happen with Obamacare that we don't even know about and can't even envision, that are completely unintended. And lots of times those unintended consequences work exactly the opposite of what it is you're trying to accomplish. Most of the time, right? Yeah. Because life is a you can't predict.
We're seeing it now. The premiums already went up about, on average $3,000 just in the 2 years since the implementation for Obamacare began. And it was projected, remember, when they passed this, they said premium was going to go down $2,500. They've gone up $3,000. And now they're what was it? Blue Cross of California was in the news last week. They announced a 20% rate increase starting January 1st.
And something completely off the radar screen. I don't know if you saw this or not, but Olive Garden and one of the other restaurants, I don't remember what it was right now.
Darden.
There were few restaurants said, you know what? We now know that if we've got full-time employees that we're going to have to provide health care from, we don't want to do that. Right. So let's take our full-time employees and turn them into part-time employees. Right. I'm sure that wasn't something that Mr. Obama and crowd were thinking about.
It amazes me how these, because it's just kind of, economic reasoning. It's just thinking,
Well, I like to talk about it like this. I like to talk about it in terms of hamburgers. I mean, if you said to McDonald's, every hamburger joint, you said, look, when people show up at your place and they're hungry and they want a hamburger, you can't ask them if they can pay for the hamburger or not. You got to feed them hamburgers. You got to give them good hamburgers. You got to make sure they're full. Well, what's the first thing McDonald's is going to do? They're going to increase the price of hamburgers on all of the people who can actually pay for the hamburgers, right?
Right.
I mean, that's how it works. There is no other option. You can only ignore economics so long, and that's only when you get to print up the money. But eventually, there's a day of reckoning.
Well, and using the hamburger analogy, getting back to Obamacare, it's saying not only do you have to give them a hamburger, but this hamburger's got to have cheese, onions, mushrooms.
Right. And not only that, nobody can compete with McDonald's. McDonald's will be the sole provider of hamburgers. The government's going to run it. Don't worry, it's all going to be
The guy says, I don't want it with cheese. You got to have it with cheese.
Yeah, cheese is good.
Let's get to Jacob Bennett. And I'm probably not going to take any more calls this show just because you guys have so much good information.
Whatever you want to do, Joe.
I mean, it's up to you. Do you want me to take calls?
I hate shutting people out. I mean,
I do too.
Yeah, let's take some calls.
All right, well, let's get to Jacob Bennett here, Green Bay, Wisconsin. He says, I can't get insurance. I have AIDS, and I got it from a blood transfusion after a car accident. Obamacare allows me to get insurance. Now I love Obama.
I just finished explaining that actually what Obamacare is going to do is it's going to force everybody else to pay for your insurance. Now, there is a way to deal with your problem that doesn't involve the government taking over health insurance and forcing everybody to have Nancy Pelosi's idea of what health insurance should be. There is a way to do that. And, purists like Marc may not exactly agree with it, but if we're dealing with realities, political realities, the same way this could be approached is the way it's approached for people who have trouble getting auto insurance, where it's required in states to have auto insurance because they had too many accidents or DUIs or whatever. You have what they call high-risk pools. And these could be, they could have government subsidies to them, or they don't have to have government subsidies to them. But basically, you have a situation where anybody who sells insurance in that region, every company is required to kick a certain amount of money into a pool. And then this pool buys insurance from a reinsurance company. Just like, by the way, insurance companies buy insurance from insurance companies to insure them against their pool going empty. And people can then pay, they'll have to pay more, and they should pay more because they're higher risk, but they can get insurance.
Yeah, I mean, you call me a purist. I kind of look at it and say, well, I'm a peaceful guy. I don't want to force anybody to subsidize anybody else's life or comfort or anything. I mean, I've said it many times and I'll say it again. Nobody has a right to live at the expense of another person. And look, when the government is shifting around billions of dollars, potentially trillions of dollars here, there are going to be some winners. I mean, there are some things that the government does when it spends so much money that produce great things for certain people. And it sounds like this caller is one of the people that probably would benefit from Obamacare. But that still doesn't make it right. I mean, there are lots of people out there that have all kinds of conditions and terrible stories. Like, crack babies are going to be born to irresponsible moms. That doesn't mean that I wouldn't voluntarily help them. I may voluntarily help this guy here, but the point is, it's my choice because it's my money. He doesn't have a right to force money out of my pocket just because he's in a horrendously horrible situation. That's what, to me...
And I'm glad you brought that up because in addition to high-risk pools, which is a more of a government way of... a more market-oriented, less intrusive way of dealing with the problem than Obamacare, there's things called charity hospitals.
And we're charitable people. I mean, remember when that tsunami... remember when the tsunami hit... was it Japan? I think where it was. I forget exactly. Thailand. And it was, now it's so easy to give to charity. I remember watching a football game and there was a commercial and it just said, send a text to this number and bam, $10 goes to this charity. I thought, wow, how awesome. And I did that and I got a text message back and it was debited off my phone bill.
But prior to the advent of government getting into all this stuff, do you think people were just left to die in the street? There were virtually every hospital had a charity wing. Doctors were required. I remember when I've been in practice that long, if you wanted to have privileges to practice at a hospital, you have to be willing to give a certain amount of pro bono time.
And that's a private rule, right? So that's fine.
Private hospital said, every doctor on the staff, you have to give X amount of time per year to the charity patients if you want to work here. And you agree to that.
And then they could market that, right? They could say, look, we're a private hospital, and but we donate X percentage of our time and effort to charity, so come support our hospital.
And then there were benevolent associations that have been, all this has been kind of preempted by government. Because there used to be so many associations from, the different labor unions to ethnic groups who emigrated to this country, to people who belonged to certain societies like, the Elks and the Moose, etc. And they formed these benevolent associations where they all pooled money to help each other out in cases.
I recently spoke to a Rotary group here, and man, these guys are hardcore charitable people.
They're voluntary.
Yeah, it's completely voluntary, and they're sitting around and they're coming up with ways to help their fellow humans who are in situations. But the difference is they get to decide what groups need help. They get to decide what amount of help to give. They get to decide at what times to give help, how to give help. That's the nature of freedom. And it's really sad because, like you say, the government has come in and preempted the whole concept of charity. And, this is a point that needs to be made, too. These people running around calling themselves liberals, talking about how they're so wonderfully loving their fellow humans. There's nothing impressive to me about going into a voting booth and voting to spend somebody else's money on a problem that you think needs tending to. If you want to give money to a problem, good for you. It's your money. Do it. That's a wonderful thing to do. But don't feel proud of yourself because you supported some candidate at the voting booth, really at no cost to yourself, to force other people to spend their money on things that you think are important. That's un-American, and it's anti-freedom. We need to get past this notion that somehow somebody throws out onto the table, here's a problem out in society, here's an awful situation. And Jeff, unfortunately, in the world that we live in, which is the only world we know about, there are infinite numbers of problems out there. I mean, somebody could say, what about crack babies? Yeah, that's a big problem. What about cancer? Cancer kills a lot of people. And what about, heart attacks? And there was just endless problems out there. And they're all legitimate problems. I don't mean to demean any of these problems, but who gets to decide? That's the thing. Who gets to decide?
There are only two ways in which humans can interact. There's either through coercion or through voluntary
that's it. And all we're saying is one simple thing. Yeah. When humans act peacefully, voluntarily, that ought to be legal.
So to translate what the caller who with HIV said into a different set of words, he's basically saying, the government is forcing everybody to make it so that I could have health insurance, and they're having to spend money on me, so I like that.
Yeah, absolutely. Yeah. And somebody else will stand up and say, hey, I got a problem with something too, and I like the fact that I can coerce my neighbor into funding my problem. And now what we've got is a competition through the government who's got the most political clout to live at the expense of other people.
Well, then we could say, like our president does, we're all in this together.
We're all in it together.
That's the justification for me robbing you or you're robbing me. I got my hand in your pocket, you got your hand in my pocket.
And the saddest part of the whole thing, Jeff, is it takes a little bit of foresight, and I think a lot of people don't really have this, to just kind of understand that if the government got out of this entire mess, I mean, let me ask you this question. Who had the best health care on the entire planet Earth prior to the government getting involved?
The United States.
We did. We had the #1 best health care in the entire world. Why? Because we had a free market. And, you know, why? I mean, some people think that we are the world's superpower for all kinds of crazy reasons. But the truth is, it's not because we love our children more than people in other parts of the world. It's not because the Lord is smiling on our country and he hates other countries and he loves our country. That has nothing to do with it. The one reason we are the world's superpower is because we have had more freedom relative to other countries for a longer period of time. The country with the most freedom is going to have the highest standard of living. Am I wrong about that?
I agree with you completely.
So what's so hard to get? And, you know, if you're not sure about this, don't take my word for it. Just, you could even look within the United States. Show me a state that's got low taxes and low regulation, and I'll show you a place with a good economy, with jobs and raising standards of living.
Absolutely. That's actually been shown empirically.
And there's no exceptions to that.
No.
It doesn't even matter what resources you've got there. You could be sitting on some of these places in the Middle East have unbelievable resources, but yet they don't even have indoor plumbing. Why? Because they got crazy dictators and no freedom and all kinds of problems going on in their country. Was that the bell for a caller?
Yeah.
That's a good system you got.
I throw that on there so you know
got to
the
do that.
caller's waiting.
Maybe something to poke me would be better.
I got that little
Let's
bell.
get the callers.
You know
in.
what? This is the last call I took, and there's others before it, but I have to bring this up.
Yeah,
It's so
bring it
good.
up.
Mamita Jones, Huntsville, Alabama, said, since you brought it up, and I'm off crack now, but I had a baby addicted to crack. Now he has tons of health problems, and I'm glad Obamacare will take care of baby Marvin.
Well, I'm sure she is glad. I mean, look, what she's saying is that, to put it into the terms Jeff was just talking about.
I'll let my attorney speak.
Yeah, exactly.
I'm a mom, and because of things that I chose to do, I now have a baby who has lots of health care problems. And so I like the fact that I can force my neighbors to pay for the health problems that I created for my baby. Right? I mean, isn't that what she said?
I'm probably Alabama.
No, but I mean, look, it is a horrible problem. I mean, from the baby's perspective, shame on mom. I mean, look what you did to your baby. That's a horrible situation, but the baby's not responsible.
But let me just tell you, again, get back to unintended consequences. You can't just keep getting away with forcing the government to steal for you or to redistribute wealth from other people to you. Eventually, there's going to be a consequence. So let's get back to what's going to happen with Obamacare. We already could see.
Let me get that mic a little closer to you there.
Okay,
Jeff.
we could
There,
already
perfect.
see in the 2 years before it's even implemented, from 2010 to now, premiums for everybody have gone up. Starting, California just announced that Blue Cross is raising its premiums 20% January 1st. Kaiser, which is an HMO, they're raising it 9% starting January 1st. So everybody in this country is going to start paying more money for their health insurance, and for health insurance, again, that they don't want necessarily or need, which means they're going to have less money left over in their pocket for maybe sending their kids to school or buying clothes or stuff like that. In the meantime, there's going to be, again, a complaint about that. And in the interest of satisfying the voters who are complaining about the high cost of all this stuff, the government clamp down on payments to providers and to hospitals, and also ration care to try to keep the costs under control, so that the person from Huntsville, Alabama may find that certain things that she wanted for her child are no longer available because we only got so much money to go around, so we're going to have to cut. And then you're going to start to see more and more doctors drop out of practicing medicine, or a different kind of practice. They're going to be these very, the kind of people who work at the Motor Vehicle Bureau. They're going to be it's already happening. Half the time you're not getting seen by a doctor, you're getting seen by a physician extender. You're getting to see a lot of times you're seeing the back of your doctor's head rather than his face because he's busy entering stuff in a computer, because he's becoming nothing more than a computer.
So, Jeff, tell me if I got it completely wrong here, but to translate what you're saying back into language that I understand better, hamburgers. What happens when people keep coming through the front door looking for their free hamburger,
Eventually we start getting bologna sandwiches.
The price of hamburgers is going to get up and up and up and up until finally people say, look, I'm just not going to spend $50 on a Big Mac.
But what you're forgetting, price going to go up. It's going to be dog crap we'll be eating.
Well, that's where we're going, right? So the government now says, hey, you can't charge $50 for a Big Mac. That's outrageous. You got to at least get the price down to $25. So what's McDonald's going to do?
McDonald's either going to get out of the business, and then nobody has any Big Macs, or McDonald's starts using dog meat and horse meat and stuff like that.
I mean, there really aren't any other choices
Right.
here. I mean, it's wonderful to say, hey, I'm going to pass a law that says free hamburgers for everybody. People say, hey, I could never afford hamburgers before. I like it because I could get free hamburgers. But eventually, the hamburger day of reckoning is coming.
It's happening now. People on Medicare are having trouble getting appointments with doctors.
We're going to be eating hot dogs before long.
Well, you know what, Mark? People, Lindsay from Flint, Michigan said, and you're going to love this one, if you ever had been in the military, then you could talk about freedom. You're an attorney out for money. You can afford health care. That's why you have this. That's why you take this stance.
If you've ever been in the military, you can talk about freedom.
What do you think about that? Have you ever been in the military,
I
Mark?
spent some time over at Paris Island
hey.
when I went to Marine Corps boot camp back in '86, and I spent some time living in a hole just south of the border of Kuwait, and during Operation Desert Storm, carrying a gas mask and taking anthrax pills and nerve agent pills.
I guess you have permission then from Lindsay to talk about freedom.
But I'm still not sure I understand the
But
question.
you
Sorry,
can't.
I can't because
No,
I
you
was
can't.
never in the military.
Yeah, so you can't talk about freedom. But
So
I'm not
never
really.
mind.
I'm not really sure.
Wait, can I vote? Is it okay to vote?
I don't think you can.
No.
I'm not really sure what the question is there. Okay, so I've been in the military, so now I can talk about freedom. What are we talking about here? I mean, I don't know.
You're an attorney. You have the money for health care. That's why you don't like Obamacare. That was her big thing.
Well,
She
look,
was angry.
Look,
Oh,
well, okay,
she was
then
angry.
look. Here's what I would say. In America, people have a right to define and pursue their own happiness, right? If you decide that you want to drive
No, only if they've been in the military.
only if they've been in the military. Well, if you're going to, only the Marine Corps. If
And
that's
Jeff,
gonna be
you
the
can't
case.
have any burgers either.
But I mean, look, people can choose how they want to live their lives, and I don't make any judgments about them. Look, I've got friends who don't work at all. They kind of lounge around all day. I've got a buddy over in Jamaica. His name's Richard. Richard lives a very simple life. I've been over there to visit him 3 times now. Richard gets up in the morning. He goes to the beach. He swims in the morning. He plays soccer. He smokes a joint. He runs a little hot dog stand. It's a simple life, and he's got zero stress. I was in court this morning dealing with how many years my client on a marijuana case, on a peaceful marijuana case, how many years spend in the joint in a cage like an animal. I got a lot of stress, but that was a choice that I made. So I can afford to drive a Mercedes if I want, or a Lexus if I want. Whether I would make that choice again, that's a discussion for another day, but that's what America's about. People are free to choose how to live their lives however they want. What America is about is living your life at the forced expense of your neighbor.
Well, Bob from Odessa, Texas, was passionate about saying, government, leave us alone. Let us live and make money and fend for ourselves. Libertarians will be in the forefront and be running America by 2016.
Oh, man, I hope you're right. Fantastic. You know, we had a meeting, and Jeff was at it last night, too, and we kind of went around, and everybody was talking about whether they were optimistic or pessimistic about the future of freedom here in America. And I would say maybe the room was about half divided, would you say?
I would say 50-50.
About 50-50. And, you know, I stood up and I said, look, optimistic or pessimistic really is a choice. I mean, if you said, hey, Mark, name 25 things that you're pessimistic about, I could do that. If you said, name things you're optimistic about, I could come up with that too. But, you know, I choose to be optimistic, and I think there are good reasons to be optimistic. And let me just cite one of them right now. When I say Ron Paul, everybody knows who I'm talking about. And when I say Ron Paul, if you're 25 and under, you probably like Ron Paul. And if only 25 and under was voting, Ron Paul's the next president. And if that's not a good reason for optimism, I don't know what is. Because I don't know if it was Jeff or somebody made the point last night about the Lincoln car. And what they said is Lincoln did such a good job marketing to the older crowd.
It was Randy.
It was Randy Paulson, a good friend of mine we have to have on the show. They did such a good job marketing to the older people to buy Lincolns. They've all died out. Their market's gone. Now Lincoln is having to reinvent itself. You're seeing these commercials now on TV about Lincoln. And I hope that eventually these 25, and I hope they don't become sellouts. Because, you know, back in the 60s and 70s, man, there was a lot of anti-government attitude out there. Then they got into office and got some political power and completely sold out. You know, I was at a Beatles tribute the other day, and what they were singing, and everybody was standing and cheering. All we are saying is give peace a chance. And I was standing up, and I was happy to hear that. And I thought to myself, how many of you really believe it? How many of you would not pass up the opportunity to support any war like it's a soccer game, to go somewhere and take guns and fight and kill people and stand up there and cheer? All we are saying is give peace a chance. It just didn't rub me right.
See, I was among the pessimists in the room, because even though there are a lot of people a lot of kids who've been excited about Ron Paul, there are too many, in my opinion, who they don't know anything about the principles that led to the founding of this country anymore. They're not taught that. So you get people coming out of, fancy universities who are brilliant people who have advanced degrees in, physics, chemistry, whatever, computer science, and they're really smart people. No taking that away from them, and they know a lot of stuff in that area, but they've never been exposed to the ideas that we're talking about in this show. So they totally buy into things like, forcing certain things on certain people.
They don't have a moral issue with initiating force against their neighbors, but
because they don't understand it in those terms.
But if you rewind and you go back 30 or 40 years and you say the word libertarian, nobody's even heard of that word. There are very few people even talking about that. And today, look at Ron Paul, for example. Before Ron Paul, we had Forbes. Steve Forbes came out, ran for president, talked about the gold standard. Everybody said he was a kook and ran him out of town. Ron Paul started talking about the gold standard, but by the time Ron started talking about people, now it's become more of a mainstream discussion. People are talking about the notion of printing up money and inflation and why that doesn't make sense. And so at least now there's some awareness on the notion that the government recklessly printing up money at will, not connected to anything of value, might be a problem over time. There are more people talking about that. Look at the drug war, for example. I know, Dr. Jeff Singer, you're going to tell me that if 30 years ago I asked you the question, do you think there will be 2 states in the United States of America who will vote to legalize marijuana, not just for medical purposes, but for all purposes? You would have told me, hell no, Mark. I hope I live to see the day, but I'll never live to see it. But we're living to see it.
Right.
It didn't take that long.
No, I think the drug war is about to come to an end.
Yeah, but think about what that means as an opportunity for freedom. The drug war is going to come to an end. We've seen I'm declaring the beginning of the end. Okay, we're seeing it. It's going to happen. Now we got a great opportunity, unprecedented in the United States, to say, look, yes, it's true crime is down. Yes, it's true violent crime is down. Yes, it's true the sky didn't fall. But the real reason to end the drug war was because people own themselves. People own their own bodies. They own their time, their money. They get to decide how to use or abuse their own bodies.
Except as the government gets more and more involved in healthcare, the government is going to own their bodies.
Yeah, but one thing we can agree on there, that ain't happening for long. It's not sustainable.
It's going to, one thing that people need to understand is, like I was getting to in the beginning of the discussion, if you're going to tell a bunch of young, healthy people that either you pay a $95 fine or you pay $900 a month for health insurance you don't need, and by the way, if you ever get to need it, we'll sell it to you, you know what's going to happen. So within a few years, the system is designed to collapse. The insurance companies are going to get out of the business because they're going to say the only people buying my insurance are people who need it, and I'm having to charge them $2,500 a month now.
So more cause for optimism. You and I are very likely going to live.
What's going to happen after it collapses?
Well, but that's what I'm saying. You and I are going to live to see the day when we get to stand up in front of a microphone and say to everybody, hey, everybody, the government took over healthcare, and look what happened. We don't have to think about what might happen. We don't have to talk about, hey, how would socializing healthcare work out? Well, now we've seen how it worked out. It was a complete disaster. Let's try something old-fashioned. Let's try freedom and just see how that goes.
Hey, Mark, we've got Jay Caston up there that says, I think that's one of the most encouraging things, no enforcement from feds. And then I've got Jay Caston saying, does that mean you endorse meth use?
I don't endorse meth use. I don't endorse lots of things, but that doesn't mean that I don't think that those things ought to be legal, because I don't decide what other people do with their bodies. In fact, Joe, if you told me, hey, Mark, I got this new thing I'm trying, it's called methamphetamine, I would rush over and say, Joe, don't do it. I've represented meth users for 19 years now. It's going to do this and that. I would do everything I could possibly do to try to convince you not to use meth. But if you say back to me, hey, look, Mark, I'm a competent adult. I'm a big boy. I've heard all your arguments. I understand. But you know what? I'm going to run my own life, and I choose to use meth. That's where I got to say, look, Joe, I respect you as a man. I respect you as a human being. I'm a man of peace. I'm not going to force myself on you. You got a right to run your own life. And I think it's an important point because people get confused about this. They say, oh, what kind of message would this send? Who cares about what kind of message it would send? It sends, people are in charge of themselves. That's the only message. How they choose to run their lives is a completely different discussion.
I agree completely.
So why can't we make that point? Why? We've got a good friend, Jacob Hornberger, who is involved with the Future of Freedom Foundation. He's a good libertarian. We disagree on some things personally, but one of the things that he says that I always thought was good, he says, look, Mark, I'm a born-again Christian. I'm a religious guy. I think prostitution is horrendously immoral, terrible, terrible, terrible. I would discourage anybody from being a prostitute or using a prostitute. Bad, 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 bad. But I'm the first guy out there to say it ought to be legal, and I don't see anything in contradiction here. And he's exactly right. That's the point people need to get. There is nothing in contradiction with saying, look, this is a bad way to run your life, but if you choose to run your life that way, that's your choice. And I'm going to say what I've said on the first two shows again the third time, because I know we've got Mormon callers out there that are upset with me that I brought up prostitution, and I'm going to hit them right back with the same thing I hit them with last time, which was Joseph Smith. Something Joseph Smith said I thought was very libertarian and very wise. Teach them correct principles, but let them govern themselves. So to my Mormon friends, do you really believe that? If you do, you're a libertarian.
Well, I can tell you right now that I know one Mormon guy who's very worried because his wife cannot conceive any more kids after the 11th one, because he's not going to get that west wing on his house in heaven that he's been designing.
Hey, you know what? Whatever the guy
and it
wants,
took 12 kids to get that. So
whatever the guy wants, that's the beauty of a free world, right? Whatever you want to do that's peaceful, it ought to be legal. It doesn't mean it's moral. It doesn't mean we're endorsing it. It doesn't mean we think it's okay. It just means it ought to be legal.
And also, morality means that you chose what's considered to be the moral path. You can't force a person to be moral.
Yeah, think
it
about
has
this.
to be a choice that a person makes.
What if we designed a machine, a robot, that all it did every single time, all it was capable of doing was choosing the right thing. Every time it handed to charity, that's all it could do. It couldn't do the bad thing. Would we say it's moral? No. I don't think so, because it doesn't have any choice. That's just the way it's wired. Choice is important. People are moral because they're free to choose the bad thing, but they opt to choose the good thing, however you define those things.
I need to make a few more fans out there right now on your show right now, Mark, because I want to say in public that if prostitution became legal, I would be the first one to open a brothel if I could.
Well, you ought
I
to be,
would.
You ought to be
I'm
able
not
to.
saying that I'd hook up with any prostitutes because I'm married.
But seriously, there's a guy in Nevada who's running one right now,
and I love that guy.
And it's a peaceful operation. By the way, I don't know if
he's a great guy.
If any of you have been to Amsterdam,
not that I've been there and know him.
And I've been to Amsterdam 3 times. And I've also been to New Zealand, and they have brothels there as well. And I'm the weird guy who shows up and opens the door to talk to the women, and I interview them.
Right.
And I say, hey, look, I'm just curious. Is anybody forcing you to be here? What's going on? There are no pimps on the street. There's no violence. They choose to do their job. When I was in New Zealand, I walked past a brothel, and I thought I'd go in. I talked to the woman. I said, hey, I'm just curious. And I was there with my wife at the time. I said, I'm not here to hire anybody, but I'm interested in the whole situation. She said, if you buy some drinks, you could talk to anybody you want. I said, okay. So I went in. It was very clean, very nice. They gave me a tour of the facility. I was talking to the women, and I said, is anybody forcing you? And they laughed. They said, you know how much money I make? I make tons of money. And I said, well, some people would say back in America that you're being exploited. They say, where are we being exploited? You know how much these guys are paying for an hour with us? It's ridiculous. But there were no pimps. There's no violence. They're tested on a regular basis for venereal disease because that's what the market wants in a free market. So if you don't like brothels, don't go to a brothel. Why is that so hard?
People just can't grip that.
I don't know. It's like this.
It's all the same principle. The same. Getting back to going full circle, back to healthcare. If you have no right to force your choices on other people, and you have no right to force people to pay for your bad choices.
Yeah, and it really, these questions are really all the same question. I mean, all these social issues going on in society, we could boil them down to one thing, which is this. Who's in charge of this particular piece of property? The owner or somebody else? Now, somebody else might be the neighbor, the majority, the president, the police, somebody else. Who's in charge? And every one of these questions we could boil down to that issue, whether it's drugs, prostitution, euthanasia, taxes, health care, they all amount to the same question. And all we're saying is the same thing every time. You know who's in charge? The owner. The owner's in charge. How about that as a novel concept? The owner's in charge. It's kind of like back when you were 3 years old and, mom came in and you got in trouble because you were grabbing another kid's toy and there was a dispute and mom would come in and say, hey, what's going on? I want to play with this toy. Well, what did mom say? Whose toy is it? Well, it's his toy. Did you ask him if you could play with his toy? No. Well, that's why he's upset. You've got to ask him if you can play with his toy. If he says yes, then you could share your toy with him too. It might work out rather nicely. And we're living in a world now where everybody's grabbing everybody's toys. Exactly. Joe's laughing because he thinks everything's about sex.
Everything is.
Joe thinks
everything. 90%.
All right. I'll give him that.
There's
one.
An extra 10
but
somewhere else.
What we're saying, and I hate to say it, but we ought to be honest about it, is really not brilliant.
No, it's basic.
It's very basic.
It's what we teach our kids.
It's what we teach our kids.
Don't hit anybody. Don't take anybody else's stuff, and keep your promises.
Yeah,
that's it.
And we also say this too in a weird way. We make a very important point to our kids. Look, you've got a nice toy, and he's got a nice toy. You might be tired of playing with your toy, and he might be tired. If you share your toy with him, he may want to share his toy with you, and the two of you can have a nice time playing with each other's toys. See, there you go.
We should have brought some rubber duckies or Tonka toys or something.
Look, cooperation is great. I mean, this is something important that humans, we know sort of instinctively, we can do more cooperating than we can do on our own, right? We can have a win-win. It's not
You know what? That's an important point you make, though, because in a libertarian it's all about cooperation as opposed to coercion.
Yes.
Those are the two. Cooperation is generally associated with a good thing. People think of it as a good thing. Cooperate. Well, that's in a libertarian society. That's the way people interact all the time.
That's all you got.
Cooperation.
That's all you got.
The only other alternative is coercion.
I got a couple of pretty radical emails after your last show from people that were talking about polygamy. And I mean, I think that if a guy can figure out how to live with 14 women and have all that work, I mean, why should that be illegal?
Yeah, I mean that one blows me away.
I happen to agree with you. Just for the same reason that I don't believe the government has a right to tell people who they can marry or associate with, whether they're the same sex or opposite sex. When it comes to consenting adults, I don't see what role the state has to play in any sort of relationship. If 8 people want to live together,
right?
But in a marital kind of relationship, that's their own business.
But the flip side is also true. If people refuse to recognize that relationship, if people say, "Look, my church doesn't recognize a gay marriage,"
that's
we don't recognize.
That's fine. It's a voluntary thing.
Absolutely.
Also.
Who are we to tell them that they have to recognize that?
And if you're a member of that church and you want to do something that church doesn't recognize, well, now you got to make a decision.
Right. And so nobody's saying that, and I think it's completely wrong to try to say that churches ought to change their definition of marriage. They can have any definition they want. So I would say, look, free people are free to do whatever they want in their married worlds. They declare themselves to be married or not married or whatever. And other free people are free to either recognize that or not. What's so hard about that? Why do we need the government? I mean, really, when you think about it, isn't it something degrading and applying to the government and filling out some form and sending it in and say, hey, please, government, recognize my marriage, and here's a little money to grease the skids so you could give me a little license that I can hold up. The government's legitimized my relationship. I think it's disgusting and un-American.
I had a politician, and I'm not going to name names, but we were talking about some different things and things I don't know about because I'm not too bright when it comes to politics whatsoever. And he was telling me, and you said everything boils down to sex, so it sparked this because it isn't true with me, of course, Mark, right? He told me that there is an actual law from the 30s that's still on the books that married couples are not allowed to have anal sex.
Oh, there's lots of laws.
Did you know that?
So do you have to get divorced in order to do that?
I think so. I think you have to be single.
Until recently, we had lots of crimes here. The cohabitation was a crime until fairly recently, and I want to say maybe the last 10 years or so, it was literally a crime to live with somebody that you weren't married to. Plus, they said they called it, I think, the infamous crime of sodomy was illegal. So, however you define that was a crime. That's been changed. There were lots of places across the country where crazy things like that are still on the books. I mean, look, it always comes down to the same types of basic things. What is it that's the role of government? I mean, what we say is, look, we're the sovereigns, right? You're sovereignly in charge of you, and I'm in charge of me. What's the government's role? To the extent it's got a role, it's our agent, right? It helps me protect my rights. It doesn't get to run my life for me. It doesn't get to tell me what to do.
In fact, we said it. We're supposedly the ones who set it up.
Yeah, if you
do that,
whether you like that or not, if you look back at the Declaration of Independence, that's what this country's about. This isn't a country that said you get your rights from the government. The government is the great collector or generator of rights that sort of divvies them out to other people if you ask nicely. That's not the concept of our country. Our country is, you got rights. You're born free. You have the rights when you're born, or maybe even before you're born. And then the government's only job, is to protect your rights.
It also says that we create this government to protect our rights.
Governments are instituted among men.
And that it also says that if the government's not doing its job right, then we have the right to get rid of it and fix and replace it with one that does.
Boy, what would Thomas Jefferson say? Who said, boy, we should have a revolution every 20 years, right? Yeah. I mean, he said some pretty the tree of liberty should be refreshed with the blood of tyrants and patriots.
Right.
Wow.
You're not going to believe this, Mark. We're already 6 minutes over.
We're 6 minutes over.
The hours fly by. We should do a 4-hour show, huh?
I guess we didn't get any calls this show, huh?
Yeah, I stopped taking them after about 10 minutes, 15 minutes ago. I turned it off.
Maybe we should do a call. Maybe we should do a show where it's just calls. I don't know if people are interested in that. No.
It all
that would
depends.
Be nice. Just ask Mark about
topic to
liberty.
topic. I mean, I take calls, but the phone never stops ringing. We've missed over 80 calls, so
wow.
That's a good thing.
Hey, we're busting it out for freedom.
We are.
I don't apologize for a freedom
right.
position, a peace position, and if you disagree, bring it on. The worst thing that possibly happens is we disagree, and we're in America, right? You got a right to disagree.
That's a fact.
Take us out, Joe.
All right. Thank you, Dr. Singer.
Thank you. It was great being here.
Yeah, thanks for coming. Awesome having you.
Mark,
and thanks for being a good pro-freedom guy.
Happy to do it.
Mark J. Victor, world-renowned, and I give you that, world-renowned attorney for freedom.
What's the question? You have been listening to the Attorney for Freedom radio show, hosted by the original man of peace and high-profile attorney for freedom, Marc J. Victor. See you next week, same time, for another dose of freedom. Until then, peace out.
Are you planning on starting a new business in this economy? As a new business, you know you'll need to watch every single dollar. Before you make any decisions on phone service, call Zentris Communications at 1-877-ZENTRIS. That's 1-877